Welcome back. Thank you for joining Consumers Doctor. On the behalf of foremost organizations, we welcome you all. And foremost organizations presents this on an ongoing basis, educational, informative, and gives you how to take charge on your personal health, how to have a personalized health insurance, so-called health insurance personalized. Today's topic is small group certificate of guaranteed coverage. We keep talking about several aspects. We have mentioned about certificate of guaranteed coverage. We've talked about cost, quality, and access to care. Today, we will talk about certificate of guaranteed coverage for smaller employers, smaller group under 50 employees. Using a certificate of guaranteed coverage for small groups along with impaired health segmentation at application and a first renewal can lower the smaller group premiums by 15 to 20%, folks. Yes, 15 to 20%. I'll explain to you how. This is what we're going to talk about. When you talk about personalized healthcare for a smaller group employers and employees all alike. If you have a small business, generally under 50 employees or fewer employees, even if it's 5 employees, 10 employees, it doesn't matter. You will have a new option to secure affordable insurance for your employees. Yes, affordable insurance for your employees. Insurers or employers can request Health Review Authority to review select lives in a small group. Select lives in a small group. A member of a fully insured small group determined to be uninsurable, just one member in the family, if it's uninsurable, will be provided access to a selection of impaired health supporting plans. Suppose if you have a family of 4, if you come in the well category, if you're segmented to the well category, but one small member who's impaired can raise the rest of the family premiums. So what happens is you apply for one family member among your employees. If there's a one family member who's impaired, if you want to give them the coverage for an employee, that family member can apply certificate of guaranteed coverage. So that way he will be getting an insurance exchange. So it doesn't affect for the rest of the family, the rest of the entire family unit as a whole. So they will still be in the well category. The premium will be lower because one family member is excluded into an exchange through a certificate of guaranteed coverage. That's how you do. You keep your premiums lower. Even it benefits the employers, it benefits the employees. This is the beauty. The other day I met someone, I asked him, do you pay for your insurance? Oh, no, I don't pay for my insurance. What insurance do you have? Oh, I have a PPO, Blue Cross PPO. It's an interesting conversation. Then I asked a few more questions. Oh, but I can put money aside into these rainy days, so-called HSA accounts. Yeah, how could you do that? Well, I have a PPO. He, the employee, so-called employee, who was participating in this smaller group exchange, didn't even know that the employer got him a deductible plan, HDHP, Health Disclosure Healthy Premium Account. It's so-called HIP, HIP, Health Insurance Personalized. I will rename that as a HIP, which is Health Insurance Personalized, which is an HDHP account. So he got it, and he didn't even know that he had an HDHP account. But the beauty about it is the employee was so happy. I have a private insurance. I put money aside into my rainy day fund. I, I like, I like what I have. I said, yes, that's good. That's what I want everybody to have. Everybody to have HIP, Health Insurance Personalized, which is a part of a deductible plan along with a rainy day fund called HSA, or Health Solutions Advantage. Employers or participating insurance companies, insurers, submitting members of a small group determined by the Health Review Authority to be uninsurable are able to exclude those members who are impaired by those individuals in a small group policy. So by excluding one member from the family, you're keeping the premiums affordable for the rest of the family. And one family member will be focused, will be given a special care, will be given a personalized health insurance. So he can get a personalized health care. And the focus needs to be on this impaired person. This is the beauty about having a personalized health insurance. So you can focus on what you need the most. Person who's mentally ill or physically ill or impaired, disabled, his premium, his policy should not affect the rest of the family by excluding one member. That's the beauty about having excluding one person, and he can get a certificate of guaranteed coverage. That one family member who's impaired will get a personalized health insurance, folks. Rest of the family will have it. Their premiums are still low, and the impaired person will get an insurance exchange. So he will get a personalized health care. Participating insurers must offer a coverage. Participating insurers must offer a coverage to the group if selected members determined by the Health Review Authority to be insurable. So once the Health Review Authority determines he's insurable, participating insurers or insurance companies have to abide by for them to be participating. Again, I keep saying, I will reiterate that. In that case, if that participating insurance companies have to abide by that rule, who's impaired person, he will be given exchange. Insurance companies will be guaranteed of the payment, so they will be covered. So in that case, the entire group would be granted a certificate of guaranteed coverage. Their premiums will be based on the segment they belong to. Like if they're well category, they will be segmented, their premiums will be lower. And that's how it doesn't affect everybody. You're segmenting an impaired member. So rest of the family will not be affected. The premiums will remain affordable for the whole family by excluding one member who's impaired. So in that case, the annual group policy renewal, any newly identified uninsured persons can apply for this Health Review Authority for access to the impaired health support plans on an ongoing basis. So annual membership, renewal membership will not be affected. The premiums will not be affected. It is still affordable. The family, entire family, the premiums will be lower, but one person who is impaired will be given a certificate of guaranteed coverage and renewable every year, depending on the condition of that family member who is impaired. This is the way to go. This is the way to go. It has to be a public-private partnership. I don't think we can lump everybody together and provide the care. That doesn't work. It is impractical. You're not focusing on the impaired person. First of all, this Medicaid, Medi-Cal, what it is doing, it's first of all, they're being neglected. They're not getting the right care. Most of the providers don't want to take care of it, and the hospitals are losing money on the Medicaid, Medi-Cal. So we need to avoid that. And people who are illegal Americans should be given the same option of personalized healthcare, either by the exchanges or from the place where they're working. If they are impaired, they should be given certificate of guaranteed coverage reviewed by the Health Review Authority. And that's the beauty. So premiums are still lowered to the segmented people who are at a well group. So their low premiums are low. If people are at risk or chronic category, if one member is in the chronic category, you can isolate, you can segment them and give them the certificate of guaranteed coverage. So that way, so premiums are renewable every year. Personalizing the healthcare for the impaired group makes sense. It makes sense because we are focusing on the people who need the most attention. If they belong to the chronic illness category, you need to be segmented. That particular member in the family needs to be segmented and should be given a proper care. And we need to focus on them, not this entire family. We need to focus on the person who needs the most care. And federal and state laws will not have to mandate acceptance standards. They don't have to mandate acceptance standards. Over time, we don't need more laws. We need less regulations in healthcare. By doing that, what will happen is over a period of time, insurance companies will begin to approve more small group applications over a period of time, so as not to have accept those with a certificate of guaranteed coverage, which may not be healthy as groups they turned away. If suppose these insurance companies, they deny particular family of providing the health coverage, over a period of time, what they will do is, by denying them, the health review board looks at the insurance company. It gives a red label, because the health review board ultimately looks at which insurer is in good standing and which insurance is not so good standing. So that keeps them. So health insurance companies will abide over a period of time. They will even accept small group employees who denied in the first place, their behavior will change and they will start accepting small group families, even with an impaired person, so that way they can lower the premium for the entire family. Employers will be employer and employee is a win-win for both the groups. So by having this ERISA law is for the larger employer group, it's a federally mandated. I think the smaller employer groups should be able to take advantage of the larger employer groups and can be linked to the larger employer groups by coming together as a group and form. They should be able to get the same advantage a larger end. So I would like to see smaller group employers, like under 50 employer groups, should be grouped together and should be able to participate in a larger group schemes. So that way the premiums can be affordable for smaller employer groups. Does it make sense? I've been repeating myself. These small groups should have. This is where our problem has been. Most of the insurance, as a, okay, let me tell you. I had medical, I've been in medical practice for the last 35, 40, 35 years. I've had a small, 3 employees in my practice. You know what? I never provided health insurance for these employees. I'm openly accepting it. I never provided health because their spouses were insured, so they didn't ask for it. I didn't have to provide it. But this is the way it goes. If you have 3 employees in your practice, if you want to provide health premium for your employees, for their family members, they should have the same capability of grouping bunch of small groups and lumping them and getting the same advantage as a larger group. All the smaller groups could be schemed together and get the affordable premium from the larger group. So they should be able to match parties. If they did that, I would have provided the coverage, because premiums, as I see right now, traditional health premiums are so high. Smaller employee groups like myself, I couldn't afford it. I could not provide it. I had to pay decent salaries for my employees. For them to get a decent salary, I have to give in somehow. Either you get the insurance or you. So whatever the health insurance we have had, we used to have personal health insurance, but for employees, they didn't have insurance. This is the way most of these uninsurable groups are in the United States. There are about 20% of the population or small group employers are not able to afford to give premiums, health insurance. So what they can do is, for a smaller group employers, provide the same amenities and give them the same as the larger employer groups, and have the same provisions. And everybody will be insured if that's the case. In addition to the salary, it needs to be affordable for smaller groups so they can participate along with the larger. So that's where the federal and state laws come in. Federal and state laws make it conducive for smaller groups to participate. So that way, I would rather put this workman's comp. Again, right now, I have about 30 employees in an assisted living facility. I'm not providing the insurance for these folks. But if they make it more conducive, I would love to provide insurance to my employees. Don't take me wrong, but these insurance premiums are so high, it's not affordable. This is where we need to segment the risk. If you have a well category, at-risk category, chronic illness category, or catastrophic. So by segmenting this risk, people are healthy, they can have an affordable premium. Employers will love to get the health insurance. They should put workman's comp and health insurance combined. So that way we don't need a separate coverage for the workman's comp. We can put, right now I'm paying for the 30 employees workman's comp. I pay roughly around $5,000 a month for all my 30 to cover the workman's comp. I wish that workman's comp included the health insurance. That's what, as a smaller employer, I'm looking at. I keep, whatever I preach, I need to practice. But you know what's going on in California? They keep raising this minimum wage. Man. First of all, every year they keep raising the minimum. I wish there is a point out there. I said, okay, this is it. We need to include the health insurance. I would love to do that, but I'm not able to do it as a smaller employer. By California mandating minimum wages raise every year till 2021 or 22, if I'm not mistaken. Till then, I'm in a limbo, man. I'm in a limbo. I'm not able to provide health insurance for my employees. I'm sorry to say, things are not, I keep reinforcing, I need to get the health coverage for my employees. How do I do it? As long as every year they keep going up on the minimum wage salaries. First of all, we need to stabilize the salaries before I could offer them. I wish they include the workman's comp and health coverage. They merge together somehow. That will be so easy for all the employees or employers, all alike. I'm paying for the workman's comp. I'm not, we're not getting the benefits. I understand the concept of workman's comp. If somebody gets injured, I understand that, but they should include the health coverage, folks. They should include that. That will solve a lot of problems. That will solve a lot of problems. Public-private partnership, providing healthcare to the smaller groups makes sense. Yes, makes sense. I keep reinforcing it on personalized healthcare. I will continue to do that. I'll continue to, on the behalf of the Foremost Organization. Foremost Organization is a nonprofit where we do give scholarships for the vocational scholarships. We raise funds to the Foremost Bingo, and people, if they want to contribute to the Foremost Organization, I love that. I have not been approaching for the contributions. I'm not doing that at this point, but at some point, Foremost Organizations would like to expand into providing even healthcare, not only giving the educational classes, we also want to provide healthcare for the folks. Ultimately, Foremost Organization would like to embrace a Kaiser model. I love the Kaiser model. I would love to have hubs which we can provide telemedicine, telehealth, urgent care, ambulatory, outpatient, surgery centers, rehab, you name it. Subacute beds, assisted living, independent. We all want to do that. Foremost Organization's goal is to provide not only the education, but ultimate goal is to get give the care what they need, Americans need. I believe in Americans, man. I believe. I salute you guys. I really salute you. I would like to see everybody focus on having freedom in healthcare. No shackles, man. We don't want to be told where to go, what to do. We, we don't like that. We want to go, we want to shop. We love to shop. You know, people love to shop for groceries and retail. I bet you when it comes to healthcare, they will love to shop. Yes. If we were given the options, Americans are smart enough. Your information is at your fingertips, man. Your information is right on your mobile phone. When it comes to your hypertension, diabetes, everything is on your phone. You have the capability to handle most of it. But when you need help, your mobile MD Live, go to mobile MD Live, Google MD Live, Amazon MD Live. Yes, Microsoft MD Live. Talk to your doctor, get the information. If you need treatment mentally, if you're depressed, if you feel lonely, call your psychologist, call your online MD, online psychiatry, onlinemdlive.com. Yes, we have the tools. This one thing COVID has done has advanced the focus on healthcare delivery. I love that. It's a challenge. I would love to take that challenge. Again, thank you guys for listening. On the behalf of the Foremost organization, we welcome you all. I'm live every day talking to you guys, and I need a feedback. I would love to chat with you, exchange information. One of these days we'll get there, but till then, stay focused on your health. Thank you. We'll see you next time.